Okay, part 2 of class 9. Anything to share after that meditation on the heart? Still mind? Peaceful mind? See a lot of nods. That's great. Cool. Then let's transition to kidney energy. The blue, went from the red to the blue-black color. Notice the background. The root of the triple burner is in the kidney, triple burner. How we clean the body, how we segment upper, middle, and lower. 3 jows, 3 wraps, 3 segments of who we are. The root of that is in the kidney. More precisely, right between the 2 anatomical kidneys. Spine. Maybe do 4 or something like this. Between L2 and L3. Right there, there's a greasy membrane that is connected with the spine. Meninges, maybe? Yeah. Greasy membrane, spiraling, Mingmen. It is called Mingmen and constitutes the source of the 3 burners. The Mingmen, that fire, the source, it gives life to the 3 elements of your body. Tongzong Hai, about 150 years ago, something like this, Qing Dynasty, last imperial dynasty of China. He wrote a book, a refined interpretation of the medical classics. I was talking, some time back, so in 1892, so 25 years ago, something like that, was talking about the convergence, coming together of Eastern and Western medicines. He was talking about integrative medicines 125 years ago, where each system overcomes its shortcomings and works together to become a better medicine. Pretty revolutionary. Never heard of that guy. Nonetheless, kidneys. And I forget. I remember I made a comment. The spleen was like if you cut your hand like this, and that's the spleen. I don't know if that was the kidney or the spleen. You remember that? Like if your heart is this size, right? And the kidney or your spleen, if you cut right here, and this little piece is the spleen. I don't know if that's the kidney, the spleen, or if that was the kidney. Maybe the kidney.
You said kidney.
I said kidney? Okay, I think I meant the kidney. Okay. I felt like I said the spleen, but I meant the kidney. Okay, cool. All right, then that's somewhat consistent. I like that. Although I could be wrong, could be the spleen, but I think it was the kidney. So in the West, it excretes, gets rid of waste, creates urine, gets rid of toxins, unwanted water. Kidney health is so important. I had a patient that was on lithium for so many years, I don't know, 20, 30 years, and had kidney failure, renal failure. And man, poor thing just ages so fast because her kidney energy is weak. She's always got toxics in her body. So the liver energy is so out of balance. Like her nervous system is so out of whack. You can see she's just so uncomfortable. And her skin looks so unhealthy. And yeah, I guess she does dialysis and she monitors it very closely, but 25, 30 years of lithium. At what cost? Her teeth have issues beyond belief. Dental, kidney, bone. That's Chinese medicine 101. Bone and teeth included. It's kidney health. It's got chronic dental issues. kidneys energy shot, or fatigue so low, energy so low. That's just not even, that's just her baseline. That's not even fatigue for her, that's just her baseline. Anyways, okay, so in Chinese medicine, yeah, regulates your urinary system, but also this reproduction, growth, and development. And the reproduction, growth, and development can include yourself. So it doesn't mean just a baby, but it also means like your cells, recreate cells. How well your cells divide, how healthy are your cells? Are they reproducing it too fast, becoming cancerous? Are they not reproducing well enough and you're prematurely aging? That's kidney energy. And even you talk about a lot of times people who have cancer in their family, a genetic component, and then they're predisposed to have it. Not necessarily will, but they're high risk. Kidney energy, reproduction, growth, and development, and genetics, endocrine. What other organ did we talk about earlier in this course that was endocrine, hormones? I think it was a spleen or lung. I would definitely work on both. When it's hormone-based, I'd work on kidney, definitely. When someone has a hormone imbalance, a thyroid issue, thymus issue, estrogen, progesterone, testosterone, I don't know, some kind of endocrine, autoimmune, I would definitely bring in kidney into your strategy, and I would definitely bring in spleen, and probably lung. You got to look at other symptoms too, depending on which hormone's out of balance. So endocrine, kidney, nervous system, liver too is nervous system, heart too is nervous system, kidney too is nervous system. So just because nervous system's out of balance, oh, give them Chai-san, liver chi stagnation. Okay, liver's fine, but kidney, we all know when we're too tired or kidneys have gotten weak, you're just wiry because your kidney energy is weak too, as well as your liver blood. Kidney stores the jing, your essence, contains your jur, your willpower, your determination, your courage, your self-esteem, your freedom from fear. And that's a practice. You have to practice that. It's like chi cultivating. You also have courage cultivating. You have to practice that. Where was I? I was some restaurant. There was like a communal table. There was a younger girl, and what was she talking about? She's talking, she saw that my kids had earphones because we had gone to someplace loud. And my kids, we have like little kid earphones. When you go to like a concert or like Topanga Days and it's loud, we give them earphones because it's really loud and they're small. And I guess we still had them. And this woman said, that's great. I'm really glad you did that. I'll tell you, the other day I was somewhere and I was at a concert. This is the woman speaking. And there was a mom there with a 4-month-old. 4 months, little thing. And a loud concert. And I just wanted to go up to her and say, you got to get that baby out of here. Or I don't know, or put something in its ears. That's like, these are, still developing, inner ear, middle ear. That's really loud sound. I said, why didn't you say anything? She said, well, I don't want to, my mom always told me don't disturb the peace, don't cause trouble. I said, well, maybe next time you'll say something. And maybe that's what I was supposed to do that day, is just be there to be that voice of someone saying, maybe next time, something really doesn't feel right. Sometimes people don't know. They need to hear that. And if they're bothered by you saying that, I get it. But I agree with you. 4-month-old, sensitive hearing. Life is already so stimulating for that little child. Just light. Just little sounds are a lot. Why am I saying that? Oh, practice willpower, courage. Courage to say something to a stranger. Just on the phone conversation driving over here today. Same thing. Someone was saying, my partner gave up smoking. It's been 4 years, 3-4 years. I said, that is great. And smoking is a tough one because, some people smoke. And I personally have developed this like zero tolerance to smoking, like zero. I know compassion, you got to be loving kindness and all that. I get it. But man, I mean, like, there's no question that it causes damage to the body. Like, I mean, 100% of people should agree with that. I don't think anybody would disagree to that. So, like, if I'm making a sacrifice in my life to being a caregiver to help people, hopefully live a happier life and a healthier life, how can I tolerate that? Not to mention, I've also had my own experience with this. My own father-in-law, had, smoking things, and because of it, had throat cancer, had to have his vocal cords removed, and, lives with a tracheotomy, ostomy. I forget which one's which. One's a procedure, one's the opening. Ostomy is the opening. Otomy is the procedure, right? Cool. Yeah, get those suffixes from the Western medical class. Got it. And that almost took his life. And, he was the talk of the party and really, would be at the party always talking and singing and, vivacious, a lot of language. But now I can't do that. So, I don't know. That's my experience with it. So, I practice courage, and which is a chi cultivating exercise that's good for your kidneys to stand up for things. Whatever works for you. Go to Dachau someday in Germany where it says never again. Where you see, the concentration camps, and there's like a sign saying, that might teach you, that may be like, oh, that's pretty intense stuff there. I remember going to that and seeing that. So learn some things in your life where sometimes it's important to stand up for stuff, and you practice doing that, whatever it is in your life. That's good for your kidneys. If you don't, it's not good for your kidneys. You will get a little bit of a kidney strike as opposed to a check, I believe. Any thoughts on that? Sorry, I got a little on tangential on that one, but kind of want to make some of this stuff alive for you. Rules water. Lung also does. Lung was the upper source of water. Spleen also is fluid metabolism, and kidneys. And that's a major issue in our body since we're mostly made of water, so you got to have your water regulated well. Rules water. Kidney are weak, you'll have dryness disorders in your body, etc. Grasping chi, as you breathe in, that's the kidney energy that grasps the chi. Exhale out, the lung chi. Hair on the skin is lungs. Hair on the head is kidneys. So hair, head is kidneys. Bones, including teeth, is kidneys. Being more stored between the kidneys. We already talked about the corpus sanjiao transforms chi and moves water. Sanjiao transforms the chi. No idea what that means. Moves water. Helps clean the body, moves energy in the body, the sanjiao. Opens the ears, kidneys, the ears, genitalia, anus. We'll go through the channel in just a moment. Coughing, breathing issue, taking air in, wheezing, coughing. I should think of this. Got this patient keeps coming in COPD, and I keep thinking her darn thing is lung. And I keep giving her Buffeton, strengthened lung decoction, or other things in that suit. And I give her acupuncture points. Tonify lung. Also, tonify the parent of lung, which means earth. So tonify the digestion. So digestion and lung. Still has that darn COPD. I should integrate kidney into that. Because COPD is pretty, chronic, pretty strong. And she does have cheap complaints like wheezing, coughing, the rest not so much. But anyways, edema. But breathing, dyspnea, difficulty breathing. So difficulty breathing is not always lungs. Maybe lungs, but you might want to consider kidney too. Constipation, water fluid metabolism. Diarrhea is the opposite. Fluid metabolism, fluid regulating. Pain in the groin, and the pharynx is where the channel goes. I don't know. Groin, inguinal, hernias. I think I do kidney and spleen hernias. I like to think of spleen and probably the liver. Genitalia, liver. Circles of genitalia is liver. The pain, kidney channel goes to the groin, pubic bone, tailbone, everything in between, bladder, up to the kidneys. Pharynx goes up to the throat. Gynecologic, certainly, reproduction, genitals, of course, kidneys, lungs, pharynx. Now, symptoms associated with a pathway of meridian. In no other modality, I doubt the osteopath, the medical doctor, the naturopath, the chiropractor, massage therapist, wherever else you work with, most of them won't know the channels. So if someone's having an issue along a channel pathology, you'll be the only one to figure that one out, because you'll identify that this is a channel pathology and you need to needle the channel to help heal the issue along the channel. Especially when you see connections. Someone's got digestive issues, but then they say, oh, right here down my leg too, I've got this tibialis issue, stomach 36, and you got digestive issues. Ah, how interesting. See that a lot. So what goes wrong? Injury to the kidney, yin and yang. Could be physical injury, could be wear and tear injury. Stay up too late, time's time, you could have that. Changes in water metabolism. I don't know. Dryness, water, too much in some areas and too dry in others. Emotional influences on poor kidney function. Emotional influences on poor kidney function. Falling prey to envy, jealousy. Can cause kidney issues, can cause things like bladder infections. Where in the West would you hear that one? Maybe Chinese medicine might offer that one. Because that's like a kidney, that's an emotional issue that's related to kidney. Someone has lack of self-esteem and courage might fall prey to envy or jealousy. Times time, you start seeing kidney issues, bladder infections. Emotional kidney disorders causing pathological changes in bone, marrow, hair, and ears. Should we meditate on the kidneys for a little bit? Yeah. Stretch your legs, twist, definitely. Stand if you need to. So the channel starts on the inferior side, bottom side of the small toes. You want to feel your toes, grab those little pinky toes. And then crosses the midsoles to the bottom of the foot. And the arch of the foot. And circles behind the inner ankle. And innermost side of the lower legs and thighs. Enters the body near the base of the backbone, so near the tailbone. Coccyx. It moves up to connect with the kidneys, the organs themselves, kidney organ, to the organs. And then out to the pubic bone in the front. And then runs up, there's points that run up the abdomen, over the abdomen, runs externally to the upper part, to the low abdomen, onto the chest, to the upper part of the chest, to the inner side of the collarbones or clavicles. And then a second branch emerges from the kidneys and moves internally up, passing through the liver, big organ liver, diaphragm, the lungs, the throat, and terminates at the root of the tongue. And a third branch divides from the lungs to connect with the heart and pericardium. Back to the kidney energy. Last few moments. Peaceful mind. Let's see. Last 3 breaths. And when you're ready, if you like, you can bring your hands to your heart. May all the good merits of this practice be offered to the liberation of all beings from suffering. And when you're ready, you can slowly allow yourself to come out of practice and allow your eyes to open. Connections we see between the heart, kidney, Shaoyin. Connection to our second circuit, or our heart is telling us it's a unique spirit, real power, courage, fluid metabolism, our voice, connecting to our tongue, our throat, our eyes. Even the heart kind of connects down to the small intestine, which has like this connection to the bladder, which is kind of connected with the kidney. And the kidney channel also goes up. The channel that goes from the lungs out to the heart. Anyways, just some thoughts. Today, as a review, we just do meditation on further exploring of the kidney and heart, Shaoyin. Meditated on both those two channels. Any questions?
We have one more week of school, right?
Yes. Next week's our last.
And that's when we turn in our journals?
No. Well, you could, but preferably email it to me in 3 days, by Saturday if possible, so that I can have Sunday and Monday and Tuesday to kind of look them over and write some comments back and get them back to you by next week. So you can email them to me. And again, your example was perfect. You know, she made this beautiful flyer. I mean, wow. She drew this. Did you make like copies of these? Like, is there? Because it looks like this is like a print.
I took a picture of it and I put it in the.
Oh. Wow. Anyways, if you want to check this one out, this is pretty amazing. But something like this, you might want to put your info on it. And your contact info and your website, stuff like that. Otherwise, it's just a complete universal gift to the universe without any time. Okay, that works too. That's great too. Fine, perfect. You had it just spot on. Just a universal gift. So either one sheet that you can give to patients, or a flyer, bifold, trifold, or however you think a patient who might be struggling with some health-related issue and meditation might be helpful for them, and they say to you, "Where should I start?" And then maybe you can give them something that has some simple concepts of instructional. Or some concept of inspiration that might get them interested, or some resources they could go to. Whatever feels right to you. But it's nice if what you create has some life post, this course. Hopefully you can use it in your practice for many years to come. So, homework: meditate every day, morning or evening, as you like. 15, 20, 30 minutes, whatever works for you. Journal a little bit. Oh, please bring in your journals next week. I'm not going to read them. I'm just literally going to go and give them right back to you because it may be personal, but I just want to see that you did it. So journals, take a half day in silence, finish writing that paper, email it to me, and I'll return it to you by Wednesday of next week if you can email it to me by this Saturday. Finish journals, yeah, and bring it in. And the bells are ringing, so that's the end of class. Have a wonderful week, everyone. Thank you so much. Thank you.